Welcome back from the break, and it's good to know you have rejoined us again on the program Good Morning Abuja, showing right now and right here only on the Unity Station. And now to our very first conversation on the program Good Morning Abuja. We are going to look at healthcare reforms in Nigeria, and I have with me a consultant neurosurgeon with the Federal Medical Center Abuja, Dr. Douglas Okor. Dr. Douglas, you're welcome to the program.
Thank you very much, Debbie, for having me on NTA Channel 5 Abuja.
You are welcome to the program. You know, when we talk about our health and the institutions, you know how important it is. Now we are looking at healthcare reforms in Nigeria. Give us an overview, insight into what healthcare reform is all about.
Okay, thank you, Debbie. I'll just make some general statements before I go into specifics in terms of how we can actually reform our healthcare system. Okay. Key thing, 133 million multidimensionally poor people. Now, when you talk about the multidimension, they talk about access. And that access is to key things like health, like sanitation, like basic healthcare and basic education. Also, there's what they call the Sustainable Development Goals. There are about 17 of them. Okay. Now, when you start counting from one, you have reduce poverty. You talk about the key issues of making sure that nobody is starving, and the third one, guess what, is actually healthcare, and the fourth is education. Okay. Now, when it comes to trying to revamp our healthcare system or reform it, we must have investments, okay, in the people. In the people and for the people. There are two key investments that you must have in the people and their health and education. The investments that you must make for the people are things like power and security. Okay, those are some key issues. Now, for a very long time, there has been a massive disconnect between the governments at all levels and the people. That's why you have this 133 million people, right, that are very poor and multidimensionally poor because of access. Okay. Now, how do you reform the healthcare system in Nigeria? There are some fundamental components that you must deal with, especially looking at the governments that are going to come. The governments are going to come at all levels. Okay, on the 29th of May 2023. First key thing, first component that you must look at is leadership and governance. Extremely important. I'm expecting that a president that is sworn in, all the governors sworn in the 36 states, and even the FCT minister, I'm expecting that between the first 1 week that they actually come on board, that they are making sure they are getting the Minister of Health, the Minister of State for Health, and their commissioners. A key thing with respect to leadership and government is that there must be coordination of the leadership that you're actually providing. We want to see presidents, governors, commissioners, Minister of Health, all of them coming together and sitting down and actually planning strategies of how they can actually reform our healthcare system. Okay. Second thing is funding and financing. Okay, to provide a healthcare system that is worth its salt, you must fund it. You must put resources to it. So you're not going to start looking at things like the National Health Insurance Act that was reformed in May last year. Okay, and looking at the other healthcare insurance systems in the subnational levels and saying, how can you coordinate them? How can you actually make them work for these vulnerable people, these 133 million people? I keep going back to the 133 million people because governments must connect with the people. The days of the people being very far, those days should be gone. Okay, so funding at all levels, funding in terms of looking at the budget. Okay, remember the 2001 Abuja declaration that says, 15% of the budget. We must slowly start moving towards that 15%. It might not be possible when you actually come in May 29th, but we should see that sort of political will, and that as the years are going on, you're actually pushing towards that. Of course, we need to actually look at the issues of innovative funding as well. Okay, things like taxing tobacco, alcohol, and all those. Okay, that needs to come on board, and then we need waivers as well. Whatever is going to happen in healthcare, you need waivers to actually support whatever is going to grow in healthcare. 13 is the healthcare workforce, the human capacity.
Very important.
Extremely very important. Okay. One of the key things we will need leadership to be doing at all levels is, first of all, to map. You understand what healthcare professionals do you have? What kind of what number and what type and what capacity of healthcare professionals do you need across board? Across board. Okay, so we need to be working on that. We need to be making sure that they are well regulated, they are well trained. We need training that is competence based, not theoretical training. Competence based. We need all the healthcare training institutions to make sure that when you look at the modules and their syllabus, and that we need to make sure that they have training in things like leadership and management and core skills like what we call non-technical skills, soft skills, the ability to communicate effectively, the ability to actually work in teams and stuff. Those are the things that you can use to actually build up your human resource. And of course, We need to get to a point where you start giving respect and dignity to healthcare providers across board. That's extremely important. Very, very important. We want a situation where healthcare providers who have been poached by other nations, who other nations say, hey, we want these people. We want them to have the respect and dignity and being looked at and we want governments that will create that environment, okay, for them to actually walk in. Fourth one, and very, very key, service delivery. We want service to be delivered to the people. And guess what? I'm expecting that any government, because I've looked at all the manifestos, in terms of healthcare, and all of them seem to say one thing, and I'm happy with that. That the primary healthcare system, the bedrock, the base, the foundation, where you're actually going to be providing basic healthcare for people, has to work. Now, someone might tell you that, oh, but that basic level is supposed to be the local government. No, well, that's fine. But we need federal governments from 29th of May to get involved in that, in terms of the funding, in terms of building the capacity of the human resource at that level, in terms of everything that I've talked about, providing the service. Okay, of course, we now need to throw in things like technology, using ICT. We now need to look at specific things like the diaspora. You have a significant pool of talent when it comes to healthcare professionals in the diaspora. We want governments to actually take strategic action, to actually get those diaspora people involved. And when you use technology, you can do remote things. You can, in a village in Buhari here, in Abuja, for example, in a primary healthcare center there, you can have a community health extension worker who is looking after a patient, is in trouble, and then just using technology, speaking to a doctor who is in mainstream Abuja here, or somebody who's in UK or in the US. So we must leverage on technology to actually make things faster, easier, better, safer, and simpler, because the Nigerian patients are worth it. The days of the governments being far and being disconnected from people must be over. We need a situation where all relevant key players must be holding all governments on their jugular and say, hey, no, you must deliver healthcare. Because remember, I said that if you want to pull millions of people out of poverty, you must invest in two things: healthcare and education. Because like I said, the Nigerian patients are worth it.
The first which you are talking about, this healthcare reform, I could see it, and we know it is going to be very, very possible. And now we are looking at reforming our health care sector, and we still need to break it down for us to understand it, itemize it, because the process also is very, very important. Absolutely. Now, having answered almost everything in one, but we still need to look at how impactful is it going to be in terms of development.
Okay, so like I said, key thing, okay, if you want to pull Nigerian population is about 250 million and counting. Yes. If you want to truly pull million people out of poverty, you have to invest in them. Okay. That is very, very key. And there are two key areas that you must invest, okay? And I've said it's healthcare and education, especially the basics of it. Okay, so in healthcare, please invest in primary healthcare. That basic, that one in the rural area and the village, invest in it.
Everyone can have access.
Absolutely, very, very important. And I'm not just saying access to anything, access at least to some basics in terms of safety and quality. Okay, the second thing is that you must invest in education. And back again, most of the time when I see people talk about education, they keep talking about, okay, yes, lecturers went on strike. No, do you understand? While that the tertiary education is important, but if you truly want to move people out of poverty, you must invest in the basic education. So that primary school level, that is where you need to throw lots of the resources, government resources. You want a situation where those children in those villages and stuff around the 774 local governments, you want to make sure that that education that they're getting has some basic in terms of standards. You know, I'm sure you've gone to primary schools in villages and stuff like that. That is not what we're talking about. We're talking about real proper investment in education, not just at children's level or children coming into a 6-year-old and so on, but even adult education, basic education for adults. Okay, we need to invest in those things. And guess what? You can significantly reduce the amount of maternal and child deaths and morbidities and problems by just educating the mothers. And educating the children. The educated mothers, the chance of an educated mother dying in pregnancy will be significantly reduced if they are educated. Yes. So these are the kind of things that we must be spending our resources and our money on. Yes, flyovers are good, roads are good and stuff like that. Yes, we should even, but more of the resources should go to be invested in the people. Like I said, health and education, because the Nigerian patients are worth it, Debbie.
They're worth it, exactly. Thank you very much, Doctor. Wow, what an interesting topic we are looking at this morning. Now let's go on this quick break. After, we will come back and continue with the topic of discourse this morning. Stay with us, don't go anywhere. Welcome back from that break, and we are still discussing healthcare reforms in Nigeria. The doctor with us, Dr. Douglas, has been doing justice to the topic. Now, doctor, let's talk about National Health Insurance Scheme. Can you tell me they are realizing their mandate as it is right now?
So clearly, Debbie, they are definitely not realizing their mandate. Okay, but everything, first things first, at least they've tried to reform from a legislative point of view. Okay. They've tried to reform the Act, okay, so we now have the Nigerian Health Insurance Agency Act and stuff. So what do we need to do to actually start moving towards where you can actually have a social health insurance scheme that actually helps, especially the poor and the vulnerable? Remember, those 133 million people?
Yes.
Okay, so the first thing you need, again, is leadership and governance, the political will. Just that political will to see and say, hey, we want to truly make this work. Okay. That's the first thing. Okay. Number two, you need significant coordination. Okay, the problem is that you have the national health insurance thing, okay, and then you have each of the states doing their own health insurance programs as well.
Sure.
We need, that's where we talk about one health, isn't it? It's one health.
Yes, we are coming to that.
Yeah, yes. because the problem is that there's too much fragmentation. So we need to coordinate things. That's extremely important. Thirdly, we need data.
Data, very important.
We need data. Okay, my problem is that you have the BVN, you have the national identity management thing, you have the PVC and stuff like that. Can we please coordinate these things? You need data. How many people do you have? Where are they? What in terms of this, their level in society, their social, are they middle class, their social class and stuff like that? Where are they and stuff like that? That data you can start using to start map out. Okay, who needs this insurance? What kind of what do we do and stuff like that? Of course, you need like the big corporate organizations to support as well. You need funds for vulnerable people, okay? And these things, like I said, need to be coordinated very, very well. So political will, data, okay, and coordination are extremely important to move us forward. But you asked me a question, are we hitting the mark? Are we getting what we're supposed to? Absolutely not. There's so much work to be done. Debbie.
Okay, now you almost talked about it, but you are going to talk to us extensively about the initiative of healthcare under one roof.
Healthcare under one roof, one health, like a particular political party talk, is extremely important. Again, it goes back to what I talked about making sure that everything is coordinated. We need one health. Yes, we have the primary health care space that is looked after by the local government. Okay. We have the secondary level care space that is looked about by the state government, and then the tertiary. We need a situation where these different levels of governments are working together in synergy. It's about the coordination and seamless movement from one level to the other, from the primary, secondary, tertiary level. One of the key things you need is that even when it comes to robust regulation, when it comes to the provision of the services, when it comes to the referral patterns and stuff like that, everything needs to be coordinated and everything needs to be in sync. Okay, that's extremely important. It will benefit the average Nigerian in terms of provision of healthcare, and streamlining processes like that will also reduce the amount of waste. Okay, one of the key problems you have is that there's duplication of functions too much.
Everywhere.
Okay, so a strategy of one health, okay, or unified health under one canopy and stuff like that will make sure that everything is seamless, things are moving smoothly, and things are coordinated, and that things are properly integrated, and you don't have all the fragmentation that we have within our system.
Thank you, Dr. Douglas. You know, you are really doing well to this topic we have before us this morning, and you have talked to us very well what we need to know. But I won't let you go without asking this question. What is the essence of reforms when most health workers are either embarking on strike or seeking for greener pasture?
In fact, Debbie, that is the reason reason for reforms, because we do have significant problems within different sectors in Nigeria. But one of the key things I've tried to do is to tell you the significant importance of healthcare. And what I'm saying is that you definitely need reforms in such an important sector, to stop some of the things that you're talking about when it comes to the apathy of the healthcare workers and the fact that most of them want the best for their lives. So we need to continue to push for these reforms. All key stakeholders, anybody who's interested in development in Nigeria, must make sure that they put whatever governments at federal level, national level, subnational level, state levels, local government, that we put them on their toes and continue to put pressure on them. Okay,
your last word before I let you go this
morning. My last word is that please, Nigerians, you have to make sure you look after yourself. Take care of your health is so important. Know that governments actually prioritizing healthcare will help you and will actually help develop the country, because like I said again, the Nigerian patients are worth it.
Thank you so much for taking out your time to give us this wonderful information. We do appreciate your time.
Thank you very much, David.
Yes. Yes, we have been speaking with Dr. Douglas Okor. He is a consultant neurosurgeon with the Federal Medical Center, Abuja, and also he is a Nigerian health sector reform advocate, and he has talked to us extensively this morning. Now,